Hello everyone, welcome to the 11th episode of our Facebook Live session, Let's Talk Health. Today we have a very important topic to discuss, chest pain and its connection to heart attacks. It is something that most of us have experienced at some point in our lives. But how do we differentiate if a chest pain is a signal to heart attack or is a less critical cause? To discuss, we have Dr. Guru Chaitanya. He is an experienced and a renowned interventional cardiologist and an expert in this field, who will be sharing his knowledge with us about various aspects of chest pain, its prevention methods, and treatment options. Without further ado, let's give a warm welcome to Dr. Guru Chaitanya. So, thank you for joining us today. Before we start session, I would request to help our viewers understand your experience and your expertise.
Yeah, thanks for inviting me. I'm Dr. Guru Chaitanya, and I finished my DM cardiology from one of the premier institute, Nizam's Institute, in 2016, and have experience of 8 years in intervention cardiology. Thanks for inviting me for this live session.
Thank you for sharing. So my first question would be like, how do we understand which type of chest pain is most likely a heart attack?
So it's a very good question and a common question that we face every day. The main thing is many of the people think that they have a misconception that once we get any gastric type of pain, it is not cardiac. See, whatever pain which starts from lower lip to the umbilicus, so whatever pain we get, we need to be little cautious that it can be a heart attack. So the main features of these typical symptoms of these chest pain are predominantly they have like heaviness on the chest, as if like a stone on their chest, and whenever they are walking, that pain will increase gradually, and once they take rest, the pain also will get subsided, and there can be associated features like they will have profuse sweating, or they feel extreme weakness, and sometimes they can even feel unconscious, they will feel giddiness, and even they can collapse also. These are the main symptoms which denote that the patient is having heart attack. And even some people can complain of gastritis, and they'll take all these medications which are available in pharmacy itself, and they'll feel that they got some relief. But it's better that if you get these kind of symptoms, and if you have diabetes and hypertension, you need to be little cautious, and you need to come to the emergency and show to one of the doctor.
Thank you. And what are the screening tests required to check for heart attack?
So this is a very important question. Previously, many people used to think that once our age is like, if it is 20 years of age, we are very much fit, and we are going to the gym, and we are doing aggressive exercises, so I will not get a heart attack. That is a misconception that is going on. So if we, there is a huge lifestyle changes and sedentary life because from the work from home due to this corona effect, and there are a lot of changes in the lifestyle changes also, because we are eating too much in the outside food, and a lot of adulteration of these oils also is seen. So that's why the preventive measures that we routinely tell is, and that screening test has to be started at the age of 20 years itself. At least we need to check once, at least your blood pressure, your whether you have any sugar levels or not, that has to be checked with the blood test, and even the cholesterol levels also has to be checked. And the screening, once if everything is normal, at least you need to repeat all these tests within 3 to 5 years of period.
Okay. What kind of lifestyle modifications would you suggest to prevent heart attacks?
So the lifestyle changes that I suggest is, initially we need to have a good exercise, that is at least 30 minutes of brisk walking. It's not the normal walking that we tend to the 80 years old guy. It is for the young guys, that is like brisk walking. That is either they need to do jogging or running. This has to be done for 30 minutes, at least 5 days a week. This has to be done. And even the intake of food also, like we need to take more of non-processed food, like too much of processed food which is easily available in the outside, that is very harmful for us. And try to avoid the fatty foods, and try to take as much as low as salt intake. That has to be done.
And what are the treatment options available for treating a patient with heart disease?
So once the patient is diagnosed to have heart attack, then we do one angiogram. So angiogram also, there is a lot of misconception that it is a very dangerous thing, that once we go through that angiogram we will have lifelong pain in the arm or in the leg. That is a very misconception that is going on. It is literally like very painless procedure, and it hardly takes like 10 to 15 minutes for a cardiologist to do that procedure. So even there is a non-invasive test like CT coronary angiogram also can be prescribed. But if the patient is coming with heart attack, and if there are any high risk factors like diabetes or hypertension, definitely we suggest for invasive coronary angiogram. So that in that invasive coronary angiogram, which takes like 15 minutes, we can diagnose what is the problem with the patient. So once it is done, then we can go for any surgery, or we can go for stenting procedures. And if the patient is coming to a hospital where this stenting or angiogram is not available, in that scenario also, if the patient is having acute MI, then we can give some drug which causes the resolution of this blood clot which is there in the vessels. That also can be done, but the patient has to come as early as possible to the hospital.
Thank you. Also, doctor, often we have seen people, patients who complain about chest pain. They delay, coming to the hospital. They either wait or delay. So why so?
So the major drawback, at least in India, that we are seeing is there is a delay from the patient perspective also to coming to the hospital, and even the transport issue now that it has been slightly reduced because there are too many available tertiary hospitals which are available. But the problem is there is a misconception that, so that's what I told you before also. For even we are seeing like 25 years old guy who is coming with a heart attack also. But a 25 years or 30 years old guy, if he has chest pain also, he feels that I'm very fit, I'm going to gym, or I'm doing exercise every day. How can I get a chest pain? I'm totally fit. I cannot get a heart attack. Maybe this is a gastritis. I'll take any remedy which is available from the pharmacy. I'll take that medicines so that I'll not have heart attack. That is a misconception. And sometimes these old people also, they feel why to trouble the patient, why to trouble our family members by saying this in the middle of the night, because majority of these heart attacks mainly occur in the middle midnight or in awkward hours, like mostly on Sundays, all these things, and they feel little scared that once we go to the hospital we may not come alive. That is the misconception that majority of the older people that they have. And one more, financial situation also. These are the major constraints which are seeing in Indian scenario.
And people who have experienced a heart attack earlier, can they adopt regular exercises in their lifestyle?
Yeah, definitely. So, and we get lot of questions from the patients after stenting, whether can we lie down on our back or not, whether the stent will move if I cough, and whether if I turn on one side, whether the stent will move. That is a misconception that they have, and everybody will ask regarding these things to us. See, as far as stenting that we do regularly, that is concerned, once the patient has been treated with either with the surgery or with the stenting also, the patient can have a normal regular life. Even the quality of life is not compromised, even the duration of the life also will not be compromised, and they will be much more active also. That's why don't worry about this. Once you have heart attack and once you have any chest pain, definitely reach to the emergency in any hospital and treat it, and you will have a normal life after the stenting or even the surgery also.
Can a patient after heart surgery go back to their work?
The patient can go back to the work within a week or so, but the only thing is what we suggest is, if the patient heart is so weak that he cannot do too much of high intensity work, in those patients we just tell them they can go to the work but not lift too many weights also. So because we need to give some time for the heart also to recover. But routinely, all these patients who come to us, they can lead a normal life and they can go to their work within a week or two. But what is more cautious is, once they go to the work also, they need to be little careful that they need to take the tablets that has been advised by a cardiologist regularly. That is a must for all the patients.
Thank you so much. Thank you so much for sharing your valuable insights with us and our viewers. I hope our viewers have gained a lot of knowledge about heart disease and chest pain. Thank you so much for joining.
Yeah, thanks for giving this opportunity. Thank you.
Thank you viewers for joining us in today's live session. Hope you have gained a lot of knowledge about how to protect your heart health. Join us every Friday at 4 p.m. for more such interesting and informative sessions. Till then, stay healthy and stay informed.